I think this is the only conference in the region really addressing patient safety on a regular basis. No doubt that our main objective for this conference is to build capacity in people who are really working in the different healthcare sectors to be able to be exposed and attend these different seminars and workshops. And of course, the keynote speech are very important for them. So the spread of the movement of patient safety continues to be at the highest level. One of the things that I think we really have to emphasize more and more is how to communicate care to the patient and ensure that they contribute to their care. And these are one of the projects that we think that we should engage more and more, is really listening to the patient and ensure that we attend to their concern and ensure that we take them very seriously, and at the same time try to explain whatever their care needs to be in a better way. And I think this is part of communication, and we learned through that with the different international speakers that have joined us in this conference.
I believe the critical message that would come out is the national transformation discussion that happened on transforming patient safety, and that was a very productive discussion on reflections from the global as well as the local experiences. So we're hoping that this would translate into an implementable strategy. And one of the things that we're proud about on this forum is the massive influx of abstracts that get submitted to the forum. So and this year, out of 200 plus abstracts, we accepted around 187, and those were coming from within the nation as well as from outside the nation. Looking at 2014, for example, where we had 40 abstract submissions, to this year where we had 200 plus abstract submissions, and the quality of submissions, the scientific rigor of either the project conduct itself or the acceptance process itself is something that keeps improving with time. So we're very glad that we're able to double and triple our acceptance and our submission rate year after year.
You can see the excitement and the passion, because this is a new field. And it's a different mind shift from the classic research that people do. So you are seeing the early taker, the early adapter, and the innovator in this group. So you are seeing those who are going to change the field in the region. So these are not regular people who are doing their daily work and going home. These are people who want to change the healthcare system, and they are going to do it.
I'm an orthopedic surgeon that does knee replacement. So when you are doing hips and knee replacement, the last thing you want is to have infected cases, patients coming back with infection. And this is the biggest complication that any orthopedic surgeon is worried about. And so we looked at the causes of infection. We looked at what we can do in our own practice to bring the infection down to as low as we could. And we were pleasantly surprised that we were able to bring it down to zero from July 2015 till now. So for the last, I would say, 2.5 years, we've been having 0% infection. So this is something that I wanted to share with the rest of my colleagues in the kingdom, and I couldn't find a better forum than this one, because I knew that there would be huge attendees, both from surgical and non-surgical areas. So that inspired me to submit the presentation as poster. And then I was glad that from the poster presentation, I was selected to present an oral, and from there, I was chosen as the first winner, so it was a dream come true.
I'm thrilled to announce that the upcoming event, which is going to be the 9th annual Patient Safety Conference in Saudi Arabia, will be held in Jeddah, in Western region of the Kingdom of Saudi Arabia. So that's going to be adding a unique flavor to the meeting. Will maximize the audience, will introduce new concepts that are centered around the patient safety, would involve different leaders in the industry to maximize the value that's going to be delivered through the meeting.